Maybach Media.
Hiccups are a brief and involuntary contraction of the diaphragm muscles, irritation of the nerves that extend from the neck to the chest and can cause hiccups. Many conditions can cause the irritation and result in hiccups, including eating too fast and swallowing air, chewing gum, smoking, eating or drinking too much, strokes, brain tumors, damage to the vagus of phrenic nerve, some medications, nauseous fumes, anxiety and stress. And in babies, hiccups may be associated with crying, coughing, or gastrophageal reflux. So, hiccups are rarely a cause for concern, but if hiccups become frequent, chronic, and persistent, let's say they last more than 3 hours, if they affect sleeping patterns, interfere with eating, cause reflux of food or vomiting, occur with severe abdominal pain, fever, shortness of breath, spitting up blood, or feeling as if the throat is going to close up, you need to see a doctor, okay? There are numerous home remedies to get rid of hiccups, including holding your breath, which is very famous, drinking a glass of water quickly, having someone frighten or surprise you, using smelling salts, pulling hard on your tongue, and many others. So, for severe or chronic hiccups that are not cured with home treatment, medical treatments include medication, anesthesia to block the phrenic nerve, surgical implantations of an electronic stimulator to the vagus nerve, surgery to disable the phrenic nerve as a treatment of last resort if your hiccups, refuse completely to go away. So the prognosis for hiccups is good. For most people, hiccups usually stop by themselves, with no lingering effects. If hiccups continue, they may cause social embarrassment and distress, and chronic hiccups may result in speech, eating, and sleeping disorders. So those are some of the, uh, how I will explain what hiccup is if I were asked. Okay, so what causes hiccups? Many conditions are associated with hiccups, but none has been shown to be the cause of hiccups. So if a person eats too fast, he or she can swallow air along with food and end up with hiccups. Smoking or chewing gum also can cause a person to swallow air and get hiccups. Any other practices that might irritate the diaphragm, such as eating too much, especially fatty foods, or putting in your mouth too big chunks of food and then trying to swallow at the same time. Drinking too much alcohol or carbonated drinks can make a person prone to having hiccups. Okay, so in these instances, the stomach, which sits underneath and adjacent to the diaphragm, is distended and stretched, as they occur in relation to eating and drinking. Hiccups are sometimes thought to be a reflex to protect a person from choking, like stop you for a second, um, distract you for a second from self harm. So, strokes or brain tumors involving the brain stem and some chronic medical disorders such as renal failure are reported to cause hiccups. Trauma to the brain, meningitis, and encephalitis also may cause hiccups. Now, this is for someone who is already sick, okay? You're sick, you have a condition like renal failure, and then now you get hiccups. So, don't get hiccups and then, all of a sudden you think you have meningitis or you have renal failure or encephalitis. No, the thing is you have to have in this point is it refers to someone who already has a condition and then they start suffering from hiccup. They will know it is one of the resulting factors of their condition. So damage to the vagus of phrenic nerve may cause hiccups to last a long time. Problems with the liver, including swelling, infection, or masses, can cause irritation of the diaphragm, which can cause hiccups. Now, this is a point that shows underlying factors, okay? Your hiccups could be innocent, or in some people, it could be an indicator of a bigger issue with their body, like problems with the liver. But problems with the liver, you gotta also put in consideration other symptoms as well that go with the liver problems. So you can't just have innocent hiccups and then you just jump straight to the liver. Okay. So some medications that can cause acid reflux may also have hiccups as a side effect. Most benzodiazepines, including diazepam, Valium, alprazolam, lorazepam, can cause hiccups. In addition, medication such as levodopa or larodopa, nicotine, ondansetron, Zofran can cause hiccups. So other medications that can cause hiccups include methyl dopa, okay, aldomet, nicotine, ondansetron, Zofran, barbiturates, opioids, pain relievers, corticosteroids, anesthesia, or chemotherapy medication. So this is also if you're in your doctors put you on some medication that might be part of these medications, then that's the reason why you might have hiccups. So if you have unexplained hiccups and you're wondering why and you're on medication, you might want to check what type of medication you're on and if hiccups is one of the side effects. Okay. Noxious fumes can also trigger hiccup symptoms. So a baby may hiccup after crying or coughing, which is common, in some instances. Babies with gastroesophageal reflux could be more prone to hiccups. So anxiety and stress, I think, is the most common cause of hiccups on grown-ups. If something is worrying you, my mom used to tell me, when I get hiccups, I've stolen something like sugar when I was little, and I'm worried, I will get caught. So as a resulting effect, I get hiccups. When you grow up, if you're not feeling safe where you are or you're feeling tensed for some reason, you might get hiccups. So if you get hiccups in this situation, then you need to take a moment, breathe, relax, find yourself again, and then, they will go away. So what are the symptoms of hiccups? Hiccups can be described as brief, all right, irritable spasms of diaphragm that can occur for a few seconds or minutes. They infrequently last longer in normal individuals without any underlying medical problems. Okay, so which types of doctors treat hiccups? Because hiccups are rarely a medical emergency or a medical condition, you will likely first consult your family practitioner or internist, or children may see their pediatrician. If this is you have a case of persistent hiccups. In the case of emergency, as described above, you may see an emergency medical specialist in a hospital, emergency department. Other specialists who may be involved in treating hiccups include otolaryngologist, an ear, nose, and throat specialist, okay, a gastrologist, a specialist in digestive tract, a neurologist, a specialist in the brain and nervous system, a pulmonologist, a lung specialist, or a psychologist, and that kind of a thing. So when should a person with hiccups really seek medical care, for the condition? So a person should see a doctor if the hiccups become chronic and persistent. If they last more than 3 hours, and they're persistent, they have you're starting to get other conditions out of it, pain, or if they affect your sleeping pattern, or if they interfere with your eating or cause reflux of food or vomiting, So you should do this if they are really getting out of hand, But hiccups are not really considered a medical condition. So how is the cause of hiccups diagnosed? So diagnosis is based on physical evaluation, okay? So you got to show up and, be going on that continuously for, like it's a situation. Everybody agrees, this is a problem for this person. So there is no laboratory testing, it is very rare. because they are suspected to be a symptom, of very normal things like overeating, and that kind of a thing, like we have said before. So, uh, if not unless the doctor, suspects that it could be from an underlying factor, then you can get sent to the lab. Okay. So how do you get rid of hiccups? So there are a variety of home remedies to resolve hiccups, which include holding your breath to drinking a glass of water very quickly, very fast. The common thread to most of these remedies is that carbon dioxide builds up in the blood or stimulating the vagus nerve to stop hiccups. So medical care is really needed to cure hiccups. If a person has hiccups for more than 2 days, then they should seek medical, consultation. Numerous home remedies to stop hiccups really do exist. Have someone frighten you, is one of, but it's very difficult to do it since you're expecting it. So it becomes a situation. Have people, dismiss your hiccups, laugh at you, um, you know, like they're bothered at listening to the sound of your hiccuping, then it forces you to push them to stop, and it actually works. Okay. Um, or having someone pull hard on your tongue, which is ridiculous to me. I've never tried that one. Place 1.5 teaspoon of dry sugar on the back of your tongue. Repeat the process 3 times or 2 times in intervals. If necessary, use corn syrup and not sugar for young children. So there are many suggestions to get rid of hiccups, such as, uh, stick a figure in the ear, tickling the palate with a swab, or swallowing a tablespoonful of honey, which distracts a person with the hiccups and may help the diaphragm relax. However, a person should only try these methods if you feel comfortable with them. Okay. Beware that some methods are not suitable for infants, like honey sugar methods. Okay. Elderly with swallowing problems and others with health problems, that allergies and that kind of a thing, you need to call a doctor for further instructions or advice. So that's the thing about hiccups. Okay. So good luck with getting rid of your hiccups, and I'll catch you on the next video. Peace.
Maybach Media.